Today, we are going to look at a BodyViz brain builder about cartilage and meniscus tears. One of the most common knee injuries is a torn meniscus. In this brain builder, we will discuss the anatomy of the knee joint, what a meniscus is, and how it can be torn. Then, we will look at a patient example to see a typical process for diagnosis and treatment. The knee is a uniaxial synovial joint. Synovial joints allow free movement and are structurally more complex than fibrous or cartilaginous joints. The articular ends of the bones that comprise a synovial joint are coated in hyaline cartilage, also termed articular cartilage. The femoral condyles, tibial plateaus, and patella participate in forming the knee joint. Accessory structures of the knee joint include the cruciate ligaments, capsular ligaments, and the medial and lateral menisci. The menisci of the knee joint are composed of fibrous cartilage, also termed fibrocartilage. As with all forms of mature cartilage, the menisci are avascular, lacking blood vessels. The menisci serve two main functions. They deepen the articulating surfaces of the tibial plateau, and they provide cushion within the knee joint. The medial meniscus is C-shaped and is securely attached to the tibia and tibial collateral ligaments by connective tissues. This makes it less mobile than the circular lateral meniscus. The knee joint is capable of flexion, extension, and limited rotation. As the knee is fully extended with the foot fixed in position, such as when it is planted on the ground, the medial condyle of the femur rotates medially on the tibial plateau. This movement passively locks the knee into position. Flexion of the knee with the foot fixed in position starts with a lateral rotation of the femur's medial condyle on the tibial plateau, passively unlocking the knee. Understanding this essential function of the knee joint will help us discuss how a meniscus can be torn. A meniscus tear can be caused by degenerative changes in the fibrous cartilage related to aging or by a traumatic injury. Meniscus tears are among the most common sports injuries. A large number of meniscus tears actually occur not because of contact, but because of the athlete pivoting or cutting as they run, such as a wide receiver cutting to the sideline to catch a pass, or a basketball player cutting during a fast break to make a basket. Remember, when the foot is planted, the femur's medial condyle rotates medially on the tibial plateau, locking the knee. If the knee rotates excessively during a pivoting or cutting movement, a meniscus may tear. Most individuals who tear a meniscus report feeling a pop in the knee when the injury occurs. Symptoms like stiffness and swelling of the joint may be delayed for some individuals. Other signs of a torn meniscus include joint pain, catching or locking of the joint as the torn meniscus changes location within the joint, and/or a reduced range of motion. Any individual who suspects they may have a knee injury should see a physician who will complete a thorough exam of the knee joint before taking X-ray, MRI, or arthroscopic imaging. These steps are essential in diagnosing a meniscus tear. Let's take a look at a patient example. You receive your patient's file and take a look. Age, 21. Sex, female. Chief complaints? Increasing pain and stiffness in her left knee since her last soccer game. You invite the patient into your office for an examination. Your patient is a collegiate soccer player. At her last game 3 days ago, she noticed a pop in her left knee when she made a turn. She was able to finish the game, but has had increasing pain, swelling, and stiffness in her knee to the point of needing to sit out of practice. You first examine the patient's knee. Upon observing significant swelling and decreased range of motion, you decide to take an MRI scan. You conclude that the patient has torn the medial meniscus of her left knee joint. There are options for treating a meniscus tear. Conservative treatment would instruct the patient to rest, ice their knee, and take over-the-counter pain medication. More aggressive treatment would involve physical therapy to strengthen the muscles around the knee joint, helping to stabilize the knee during movement. The most aggressive treatment would be one of 3 types of surgery. Repair of the meniscus involves suturing the torn pieces of fibrous cartilage together so that the meniscus may repair itself. Trimming the meniscus involves removing the damaged segment of the meniscus and retaining the healthy, undamaged segment. Physical therapy is then required to strengthen the muscles surrounding the knee joint. A complete meniscectomy involves removal of the entire damaged meniscus. This is typically the last surgical option, used only when the meniscus is too damaged to salvage any part. After evaluating your patient's meniscus tear, you order arthroscopic surgery. The surgeon makes 2 small incisions in the knee and trims away the damaged part of the meniscus, leaving the healthy portion in place. Complete recovery from meniscus surgery can often take up to 3 months. At first, the patient must keep as much stress off of the affected knee as possible. Over-the-counter or prescription pain medications may also be recommended, as well as physical therapy and at-home rehabilitation exercises. A few months after surgery, with the help of physical therapy, your patient makes a full recovery and regains her range of motion without pain. This has been a classic example of a meniscus tear. Thank you for watching this Brain Builder video. Please like and subscribe to our BodyViz channel, or, if you are new at BodyViz, check out our other anatomy resources and schedule a demo at bodyviz.com.